I'm back. Of course I am. Because I could tell stories upon stories about just how broken and unpatient friendly our healthcare system is. Today's episode of Healthcare Hack, titled The Painful Bunion, I'm going to explore how one patient did everything right and still ended up with a $30,000 bill. Hi, my name is John. I'm your healthcare hacker and the host of the Healthcare Twilight Zone. Our journey into the Healthcare Twilight Zone today is about Charlotte. Charlotte is a young woman, overall in good health. However, she has a bunion on her foot. It's very painful. She can't exercise. She can't wear normal shoes. It's just hard to walk. It's become so inflamed, she just can't get around. It's impacting her quality of life. Charlotte's actually a student, and she wants to get this taken care of before she has to go in the professional world and get a job where she studied to be a physical therapist, where she'd be on her feet a lot. So it's really important to get this fixed. Charlotte, with her doctor, tried a lot of different conservative treatments, tried orthotics, tried you name it, but just nothing seemed to work. It only got worse. So eventually surgery was recommended. Now, Charlotte was concerned about the expense of surgery. While she had insurance through her parents, because she wasn't 26 yet, she didn't have a lot of, she didn't have a ton of resources. So she wanted to make sure that everything was going to be covered and that you only have to pay her normal out-of-pocket expenses. So she did her due diligence. She made sure, not once, but twice, she got letters from the insurance company to make sure it's medically necessary. They reviewed her case and said, yep, that surgery is medically necessary to remove the bunion. Additionally, the doctor had looked to get prior authorization and received one. Everything looks that she had the surgery. It was very successful. What could go wrong? We're in the Healthcare Twilight Zone, so something had to go wrong. And the claim was denied. Wait a second, John. Why was the claim denied? How could it be? Well, it was considered that per her benefit plan, a bunion removal was not covered. It was crazy. It was considered medically necessary. Her doctor had gotten prior approval. Yet, in her benefit plan, there was a line that says, your health plan does not cover treatment of anything with your feet, including bunions. Now, it didn't say that surgery wasn't allowed. It didn't say, well, if there's an infection or an inflammation, we'll cover it. It just said, we will not cover this. So, Charlotte, successful bunion surgery, but was facing a $30,000 bill. Well, this is where we get involved. You see, the weird thing is, because of how it was denied, it said Charlotte was responsible for the full charges. So the doctor, the hospital, or surgery center she had the procedure done, never actually appealed it. They just sent her bill for $30,000. Well, when we got involved, we appealed it. Now, sadly, we weren't successful. We could not overturn the denial. And that happens too often because in the end, it was, well, this is what it says. It's close enough. We're not going to cover it. The consumer really has no responsibility. And that's what drives me nuts about the Healthcare Twilight Zone is in the end, someone made a mistake. Either it should have been covered and the health plan should have told the provider, or the provider should have asked if it was covered. The one person who did everything right was Charlotte, and she ended up with a $30,000 bill. Now, luckily, we were able to work with a provider, and she was in a financial situation where we could basically get a significant financial discount through financial assistance and help her apply for that. But it just highlights this story about how broken the healthcare system is and how unpatient friendly it can be. There's no reason why expensive surgery, $30,000, should ever be denied. And if it is denied, it should never be the member's responsibility. But it happens far too often. I truly hope it doesn't happen to you or anyone you know. If it does, please contact us here at Athos Health. If you have any questions about this video, please leave them in the comments below. We'll try to get back to you in person or in a future video. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.